I ended up having surgery. I brought my daughter here the day of my surgery and for like 2 weeks after I had the surgery to recuperate, which helped a lot because I ended up having some serious complications. You know, she wasn't in childcare due to the pandemic.
I don't think any of us could really anticipate how difficult the pandemic would be and how hard these last 2 years were. We really just had to take an opportunity to step back, look at our service model, and figure out how we can best meet the needs of our clients, because our families are still in crisis. It's not always even necessarily related to the pandemic, but made much more complicated and complex because of it. So we had to figure out how can we find that balance of still providing good quality care to the families while keeping them safe, keeping our staff safe, and still making sure that we're delivering the family preservation services that we're really known for.
Oh, we had a whole new safety protocol we had to follow. It was very hard because every week it was changing. So every week we had a different meeting, and we had a COVID team that kept us informed on everything that was changing. A lot of changes, but we kept up with them.
So one of the silver linings that have come out of the last 2 years is really creating a really dynamic service delivery method that allowed families to do programming both virtually and in person.
I obviously couldn't come visit her, so you know, trying to do video calls with her. I was able to call as much as I wanted, and for me emotionally, she was like a motivation to get better. And being able to see her and just see her laugh and play, you know, that made my day for the day. I was okay then, you know.
At first it felt a little overwhelming, but then it came to a point where like we got creative and we were providing services and just being on the phone, listening to parents, letting them vent, really making sure we talked about the whole family.
It's a way for us to kind of talk without feeling judged.
We realized that we were able to help families overcome a lot of their barriers with things like transportation or childcare for children that weren't admitted to Providence House. We had such high rates of parent engagement during this new service delivery model that we were piloting that now it's just part and parcel of what we do every single day.
Basic need items were huge. That was awesome to be able to do that. And we provide meal kits to families, fresh produce, which they were so appreciative for. We did toy giveaways, diaper giveaways. We did a Coke giveaway that was huge. So just really getting creative with the team to use our internal resources and then also looking outside to say who could we partner with to really meet the needs of our families.
Anything that they may have, they give, and if they don't have it, we usually will try to refer you to somebody else that might have it.
It's the love of the children. It's the love of the children and support for the families, because we know our families need us.
I owe Providence House everything that I am today.
I think the team at Providence House is extremely committed to making sure that we meet the increased demand for our services in the community. And with lessening restrictions with the pandemic, it increases our capacity to serve children on the west side. But also our east side crisis nursery is on the horizon, and we're really excited about expanding again our ability to serve more families. And we need your support now more than ever.